I've been involved with this population cohort since 2009 now, and it's been a fantastic build. We are at a point now where across Canada, we have approximately 1 in 50 Canadians who have signed up and registered for this program, the bulk of which come from Ontario. And so that's really exciting, is that we're seeing such a great investment by the population into their own resource.
I mean, a study like this requires that we collect data from individuals at baseline, that we follow them forward in time, and that we see who develops, disease or other outcomes of interest. And it's only until we accrue a large number of these outcomes that we can actually start our research.
My name is Philip Awadallah. I'm the Executive Scientific Director for the Ontario Health Study.
I'm Vicki Kirsch. I'm a professor at the Dalla Lana School of Public Health at the University of Toronto.
We're hoping to be able to try to identify what are the major influences that impact why you develop a particular chronic condition with time, why somebody who lives down the street from you may not be developing the same particular disease.
So I received research funding to conduct a study looking at the determinants of lung cancer risk. I'm using geocoded residential addresses to come up with exposures of outdoor air pollution and radon, and to see if those are associated with the risk of lung cancer.
One of the major questions in our laboratory is that we're interested in understanding or discriminating the genetics bioenvironmental interactions with respect to people's health. So using the Ontario Health Studies data allows us to ask questions about the genes by environment in terms of what makes you develop a disease over time.
Well, I'm hoping that we'll see that there's variation in terms of everyone's exposure to air pollution and to radon across these cohorts, and that we'll be able to associate those differences with risk of lung cancer, and that this will really shed new light on the etiology of lung cancer.
If we didn't have access to this data, it becomes a challenge for us to be able to really help both the Ontarian as well as the Canadian population, as well as the international population.
As we publish findings, really, as things hit the news, they'll hear about the Ontario Health Study, and they'll know that, that study was made possible because of their individual and collective contributions.